Alaikum guys, welcome back to CHOW CHAT with Yaseer. Today I have a guest from a very interesting walk of life, a field that I never thought I would be curious about, but lately I've been asking questions and I think I need answers today. I'm here with Dr. Nana, and as you know, our tradition, every guest has a name. So her name is the Femme Guardian, for a reason that she will tell you based on what she does. So she's an obstetrician and a gynecologist. Dr. Nana, can you tell us more about that particular thing that you do professionally and creatively, if you do?
Okay, so I'm actually an obstetrician and gynecologist in training. So I haven't quite completed my training yet, but it's still ongoing. So it's basically, we deal more with women, pregnant women and not pregnant women. And we're the ones that see them in clinic and so on and so forth.
Okay, yeah. Perfect. So overall, for me, I feel like what you do professionally. So I would say some people don't really know more about it, because I feel like it's something that I'm interested in and I'll go for it. Not like a general thing. I think it's more niche concerning the knowledge of it all. So, but before we get into the whole talk about that profession, I personally want to know. Many people we have on here also have some creative contributions they have on the side. So are there other things like maybe poetry or something artsy that you do?
Oh gosh, this is embarrassing. I don't have anything on the side. Like, I'm very, very into medicine, which I want to have maybe inshallah, a New Year resolution eventually, or a resolution of some sort to really diversify and go into more things that are on the artsy side. I've always been a science person, so.
But do you believe in New Year resolutions? I think every day can be your New Year.
Yes, exactly. That's why I changed from New Year's resolution to a resolution eventually, inshallah.
Because it's I think that's the safest thing to do. So now that we have established that, hopefully there is one creative thing coming around the corner.
Hopefully.
And yeah, inshallah, watch out. There's something coming for you guys. So before we get to the point of today's episode, I'd like to I want you to shed some light in terms of healthcare in the country and its accessibility. And I've seen patients to wait outside the hospital for unnecessary reasons, like maybe not being able to afford certain things, and to just be there for the entire day, and the other people are being attended to, but they're just hanging around there with no attention being paid to them.
So right now the state of healthcare in Nigeria is not the best. There's a lot of room for improvement. So we're facing a lot of challenges, especially when it comes to finances. I think it cuts across every aspect of the society, but especially with healthcare. Like in other countries, it's subsidized or there's insurance also. But here, a lot of our healthcare is out of pocket. So you're having people have to make the choice between, buying medicine or buying food. And, for the ones that even when they eventually do make it to the hospital, drugs are too expensive, and, some common supplies like gloves, syringes are not readily available. You have to go and buy them. So, definitely there's a lot the government can do in that aspect to try and just bridge the gap and make it more accessible to people, so that we're not having people just, you as a doctor, your hands are tied to a certain extent. You can't do everything for a patient without the material to work. So, that's really where we are at the moment. But inshallah, hopefully things do improve.
Hopefully. Because I also have something to add to the point you just made now on how things are so bad. I will not discredit any hospital, but we've been at a hospital where there was an accident, and then we had to go to the emergency room, and someone passed away because there was no oxygen.
Wow.
And I was wondering, it's called an emergency room for a reason. So if someone can lose someone in the emergency room because of lack of oxygen, I think then if everyone passes in the other part of this thing, distraction. We're back again. So, so I feel like if everyone, what I was saying, see the distraction. What was I saying, please?
Oxygen.
Okay, oxygen. So things like oxygen are quite important now, and they aren't available when there's an emergency. So that means on a casual day, they won't be available at all. That's just what it means.
Unfortunately, that's where we find ourselves.
Okay, so I want to take us to the past, where I think the medical sector was the most interesting of them all. That was during the pandemic, the COVID-19 pandemic. I think a lot of remote things came to become the only successful things to be involved in. And during my own 007 research, I found that you also have Al-Siha clinics.
Okay.
Yeah. So my perception of e-clinics, based on how I knew it during COVID-19, was people having access to medical attention online and also having these particular prescriptions be delivered to them through that platform. So let's hear more of your CHA clinics and also what you think about the e-clinics overall.
Okay, so Aisha Clinics is a clinic myself and my husband, who's also a doctor, we founded in 2021. Although it was after the whole COVID-19 pandemic, but we're just coming out of it at the time. But the demand was such that, okay, it wasn't even only, I think the COVID pandemic really pushed us into doing it at the time, but it had always been something that had been at the back of our minds, just based on the fact that people end up going to the hospital, long waiting queues, and for something as little as things that you could just maybe have a phone consultation, and a doctor on the other end could, solve your problems for you. I mean, it's not a one size fits all. Definitely, there's some conditions that you have to be seen physically, but a lot of minor things can be diagnosed over the phone or online. We even offer like physical consultations. We come to your house or to a place of your choosing, at the convenience of both the doctor and the patient, and we see, examine, and give our diagnosis and prescriptions from there. So and then it's not just like we team up with a lot of different doctors, not just me and him. Like we have specialists in other fields that also come in and consult and then give their own diagnosis depending on what the patient needs. So I think we've tried to bridge that gap between waiting times and inconvenience and making medical consultations very accessible to people. Like everybody has a smartphone at this point in time, more or less. So, we're able to actually just get in touch with patients, and it makes following up a lot easier. Cost of having to drive to the hospital is reduced and so on. So, hopefully we can do more and expand in the Nigerian.
Inshallah, hopefully.
Inshallah.
So I'm curious, the keyword there was accessible. And so we're talking about access to things with the ease, not particularly financially, just the ease of having these things. Because like I'm hearing deliveries and additional cost to things, so but still, yeah, because I understand that a lot of things are so beautifully said and they work beautifully in other places, but because of the purchasing power in our country particularly, you start hearing a whole, people want to bargain on an app that clearly has a solid fee that shouldn't be a fixed fee. You start hearing, Madam Abeg, like, the whole thing,
haggling. It's in our blood.
Any chance we get. So that's wonderful. We learned about the e-clinic bit, and we're taking a dive into why I particularly call her the Femme Guardian. But before that, we're going on a short break so that we can eat food, because this episode we don't want to be rough now. We have learned our lesson. We want to eat it off the cam and then come back to be more organized. And shout out to Mouthbomb. Apparently she's having what do you call it? She's going to be at this fusion thing. You guys should be there and come and chat with us. So let's see the amazing thing she brought for us today. And you will see me open it on the camera, but you're not seeing me eat it. Okay. We have puff here. And in here, can they see it? We have wings. Me, I consider it the best wings in Nigeria. So I consider I'm giving her that. So like, I really love the wings here. So as we go for our break now, see us when you see us. Peace. We are done eating. Alhamdulillah. So now we shall continue. Welcome back. I think last we left, we were taking a dive into why she's called the Femme Guardian. So briefly, I want you to talk to us about the developmental stages of womanhood from infant stage to an adult stage. This will help us explore the general aspect of these stages and the basic suitable healthcare option per stage. Because personally for me, I feel like not many people understand the different stages have different ways to care for yourself.
Okay, so for women or girls
Yeah.
or females, let me put it that way, there are several stages of development. So, we have the childhood stage, which is roughly from when a girl is born till about she's, 10, 11 years of age. Then we have like the prepubescent puberty stages, which is from 11, 12 to about 18, 19 years of age. Then from there we have the adulthood. So we're talking 19 years to like, adulthood or the reproductive ages, like we call it in my own specialty. So it's like from 20 years of age to about 50, 51 years of age. Then 51 years onwards, we call it the postmenopausal age or climacteric age, which is basically women that have passed their reproductive years and grown older, rather, let me put it that way. Yeah, so those are the different stages. I mean, the ages overlap, of course, depending on, depending on society as well, because of course, some climes have an earlier age or generally earlier age of girls reaching puberty and so on and so forth, or menopausal ages can differ from society, but those are roughly the ages that we use.
All right. Thank you for giving us briefly that information that we very, very need to we need to learn. So Islamically, cleanliness is held in high regard, and a lot of parents, due to shyness and we know the culture and all this, and they're shy to speak on certain things, which is not really their fault. It's what they grew up around. Is the only thing that's normal to them, and they tend to skip certain factors in terms of like puberty, mostly for like people. And I think in the world of tech today, a lot of people just have access to learn these things online, and in a way, it helps the parents. They don't have to worry that the kids will know these things, but in a way, then they can go learn wrong things while doing these things.
Definitely.
And personal hygiene, like I started with. So in terms of personal hygiene overall, I think I don't know what part it is that like we can speak of here. We can speak of on here that you can discuss for like females to also not take care of themselves in terms of hygiene overall. So you can just briefly give us anything that you can that will benefit the viewers here that are ladies that want to also understand personal hygiene overall.
Okay, so for women, I mean, as opposed to men, like we have definitely some special circumstances that happen and so on. So like hygiene is very important. It's not even about only a gender thing. Like Islamically, of course, cleanliness is half of our deen, right?
Yeah.
So it's very important that we're all clean and just for one's personal and mental well-being, it does a lot to a person just to be clean and, for their own self-esteem as well. So, like you mentioned earlier about the awkward shyness, that parents do feel. I feel like things are shifting a little bit. So with the age of tech and smartphones, and unfortunately smaller kids having access to smartphones, it's both a blessing and a curse, right? So like there's a lot of information, but unfortunately a lot of that information is not filtered. So and as a parent, you're shying away from teaching your kid the necessary things, but they're falling victim to things or practices that are like, totally wrong or baseless, or that would even cause them harm eventually along the way. So like so my advice I would give to, first of all, to parents, I want to assume that whoever views this video, whoever woman or man, even if they're not parents already, they're going to be parents, inshallah. And it's always nice to just, bear in mind, like, what kind of parent you want to be. Are you the parent that wants, your child to have to run to social media or to see things online? Or it's not even about online, like children around or outside influence to be what molds your own child. So a lot of us don't want that, of course. So, it's like you want to have that little bit of knowledge. You don't have to be an ONG person like myself to say, this is what I want to impart, the type of knowledge I want to impart on my daughter. as she's growing up and so on. Like starting with basic things like, okay, hygiene, for example, like as a young child, bathing twice a day, making a routine that, okay, if she goes in the morning, she'll bathe. In the afternoon, when she comes back from school, she bathes. Brushing her teeth twice a day as recommended by dentists. Okay, keeping things organized and in a good space, making sure her clothes are clean. Organizing. Things like that can be put in routine, so that when eventually she reaches the age of adolescence and puberty, it's like these are things that are imbibed in her that if she doesn't even do, she won't feel good by herself. And when girls usually reach those ages of puberty, in both genders, but I'm more of a female specialist, so I'm going to speak about girls. So there are a lot of changes that happen with the body. So with obviously the obvious ones that we all know with regards to menstrual cycles and stuff, but there are a lot of other bodily changes that happens. One, hormones start to become more active and develop, and that causes a lot of bodily
Chaos.
Let's put it that way, bodily chaos. Increased sweat glands, those hormones all have effect on the body. So definitely keeping that hygiene is very important, especially, of course, as a woman grows up or as a girl grows up, she has now become a balig. So, she's going to be required to pray as per Islamic law. So, it's very important to just demystify all of these things and just teach it. It might be awkward, but so far as it is taught, there's very little way for someone else to come and influence what you have put into your child.
Okay, so thank you so much. While we are on to family involvement, as our virtual mother set now, we've mostly focused on having the perspective of the female parent here, and I believe we have situations where maybe there's a single dad taking care of the entire family. And what do you think about the male gender in terms of a spouse or a parent also understanding these things for the child or for the spouse as well? What do you think about them also having knowledge on these things?
It's definitely important to have that knowledge in those in the opposite gender. I mean, in the household, if there is a two-parent household, it would be the mother that would have that conversation. Of course, it makes it, even though it's a bit awkward, but it's less awkward than the father having that conversation. But then there are some special circumstances, like you mentioned, like a single dad, and he's the primary parent. He has to have these conversations, even if he doesn't have this conversation, or maybe he pushes it to an aunt or so on. Day in, day out, he's the person with this young lady that's growing up. So even if he doesn't have certain talks with her, supporting her in little ways, he has to understand some of the things she goes through, as she's growing up, so as to support her the best way that he can and not alienate her, because it's that alienation that pushes people to seek information. A child is a very curious person, whether they have come of age or not. We're seeing it with younger and younger children. They even know how to go on YouTube and Google and stuff like that as soon as they learn how to talk, or even press one or two things. So the developing mind is a very curious mind, and you want to feed that mind with information, and you don't want to alienate a child, especially when they want information. So I think it's really important for a father to pull your child close. There's nothing wrong in just supporting your child in that way.
Okay, fathers, you have heard, there's nothing wrong there.
Yes, there's
support the kids. And a while back you mentioned something about hormones, and I personally have had. Sorry, excuse me. I have to excuse myself now. I'm done chasing the ducks. I'm back again. So you get used to it. We have a farm in this house. I mean, in the studio, we have a farm. So I had a conversation with a friend of mine a while back about hormones, and then when you mentioned hormones today, I will ask, because I think it's a chance for me to also learn. It wasn't an argument; it was just a conversation about how she said ladies experience hormonal imbalances, and then I said, "Oh, I'm lucky. I'm a guy. I don't have this experience." And she's like, "Who told you? Guys also have this." Da, 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 da. So now that we're on that topic, we would like for you to also explain to us what these things are and why it's normal for like everybody to have them.
Okay. Well, she's right about men also experiencing hormonal imbalances. The term hormonal imbalance is a very broad term. So it like medically, it covers quite a number of disorders. Of course, for the layman, it's just easier to say hormonal imbalance and then it just like covers everything. So, but it's even though it's more prominent in women because women, of course, hormones tend to go up and down all the time, as a normal physiological thing to happen. Men less so, but it still happens in men. Men still do experience some levels of hormonal imbalance, which can predispose to certain disorders that, of course, they can see their own doctors about. That's why not my own field, but definitely, yeah, there are hormonal imbalances in men that men do experience.
We'll have somebody here to tell us why we also have it. I'm curious. I'm very curious. So there are medical issues that mostly affect ladies, and since this is a lady episode, we want to stay in that window without branching too much. There are some diseases that can be prevented, and some can only be managed because that is how we have come to understand these diseases. And do you think there's enough awareness being made about these diseases, like breast cancer and other things? Do you think they have awareness? Because I feel like some people don't know, and some people don't even know where to find out these things. I know when you go to the hospital, you see maybe charts and posters. People don't really read them, but I know they're there.
Yes.
So, how else do you think like this can be communicated to others as well, based on your profession? Do you think have you met patients that have no clue about these things when you attend to them?
I mean, definitely, there are patients that have no clue, although they're very few and far in between, just because of the age that we live in now with, access to information it's like literally at your fingertips. So like your phones, your TV channels also have a lot of awareness. There's this particular channel that my mom loves watching that they're always in between shows. They're always talking about, breast cancer and how to like detect it and so on and so forth and when to go for checkups and whatnot. But I think we're doing a lot as a society, or rather, let me say, in the medical field right now, in Nigeria specifically, to really spread the information across. We're having people reach out through radio stations, do interviews through radio stations, TV channels, commercials, billboards are being put up and so on, just to like really raise awareness. People are going out into the villages and, through explaining in a way that a person would best understand that, okay, these are the reasons why you need to go to the hospital if you notice A, B, C, D, and E, and to really get checked up and stuff. Because something you mentioned about there's some diseases that are preventable and there are some that are just manageable. I feel like with regards, let me use specifically to women, with regards breast cancer, with regards things like cervical cancer and so on and so forth, they're preventable once caught early. Or rather, sorry, they're preventable, but as well as they're totally curable when caught early. So, and this all comes down to knowledge and seeking of healthcare very early, For like breast cancer, it's usually recommended that women do a self-breast exam monthly. And then, every year, a woman can go to the hospital and then get examined by a doctor. For cervical cancer, the screening, we usually do a pap smear. It's called a pap smear, and then it's recommended to do it every 3 years. So it's not something that you have to go every month to get checked, that type of thing. And it's important that people realize that, if you dedicate just one day in a year to get yourself checked and know that, I'm done till the next year or till something goes on, it's in anything, prevention is better than cure. So it's better. Of course, for your own peace of mind, it's better on the pocket, and I could go on and on and on about how just prevention is better than cure. So, yeah.
Thank you so much. Because I was going to ask you about what you think about checkups. Because I think when we talk about prevention, if you don't check for things, you would never know you have these things in the first place. But you have covered all of that. So we can skip to a very interesting question now.
Okay.
Your profession is a very old, historically known profession. And I think at the time, maybe it was just called from midwives that have additional roles at that time. But today now we have them in different segments. So a friend of mine was telling me that I think like people, like the medical sector is trying to change the roles of midwives medically today by converting one of the things that you do, which I cannot pronounce very well. One of the two, like they're trying to convert them into the midwife thing overall. So, do you think like the role of a midwife has changed from back then till now in terms of relevance? Are they even relevant today anymore?
They're very relevant. In any hospital, you'd find a midwife. So far as they take deliveries in the hospital, you'd find a midwife.
Okay.
In fact, you would find a midwife before you even find a doctor. That is just how relevant they are, because these are people that are trained whatever society you go to. They're people they're women that are always getting pregnant and having babies, and our midwives are those that are trained to take deliveries and in a very safe manner, so as to just prevent complications and so on. Of course, in our own role as doctors is like we go to school, and they go to school too, but we study not just the childbirth, but we study in a more broader, women and women's health and so on, and we come in as more of a superior level, or more at a superior level than midwives do, but we work hand in hand. In most hospitals, you would have a midwife there taking deliveries and making sure, at least at the very basic level. If you go to primary healthcare centers now, for example, in the villages, it's midwives that are taking deliveries without any doctor that is there. They're the ones that make sure everything is fine. So, they're definitely very, very relevant as we are now. Things are definitely diversifying. You're having maybe some that are more experienced than others, or some that are in more urban areas that have more exposure to like what's it called, technology. So like they're exposed to certain machines, but it all boils down to having the experience in doing the same thing and making sure the mother and baby are healthy at the end of the day.
Okay, wonderful. So realistically, some people think your profession is for a certain social class in terms of people that you receive and you attend to. So, what happens to those who can't afford these things? I know we talked about checkups and also figuring out what's wrong with you, but realistically, some people don't even know the importance of this, and they don't even have the facilities to have these services. So, let's take an example with a pregnant woman with access to the right medications or even the right medical advice. How does she now go about certain things?
Okay, so like with medicine, from time, or even now actually, from medicine, it all starts from food, right? Food is the best medicine at the end of the day. And all of our medicines that are being used, these pills that we take, are all synthesized from some form of plant or another. So that being said, like I know a lot of people there are a lot of financial constraints going on right now in the country with the way things are, and people are kind of like trying to find a way to bypass maybe going to the hospital, getting regular antenatal care, which is very important, by the way. But in cases where people absolutely can't afford it, just taking care of oneself with regards to their diet is very important. Like a pregnant woman, it's definitely, I know they say they should eat for two, but which is not true. But definitely increasing, the food that she takes, but most especially eating very healthy foods. It's not the time to go and start eating. Although someone that can't afford medication is not going to be the one eating shawarma and but making sure that the foods that they're eating a balanced diet, eating foods that are very rich in vegetables, fruits, and so on. So I know it's kind of like an oxymoron in a way. Like, okay, someone that cannot afford basic medications might not be too privileged to have fruits and vegetables and so on, but we try to make do with what we can. And yeah, I mean, if it can be made in such a way that, okay, even though she's not getting the medication, she's able to eat very good food, then alhamdulillah, inshallah. God will see her through, and mommy and baby will end up being fine.
Inshallah. And beautifully, I think, like you mentioned, even back in the day, they didn't really have prescriptions. They ate well and they lived well.
They did.
Yeah,
they did,
so that was just it. You can
hopefully, we're able to emulate that.
I hope so too, but I think it's a bit too late. But I hope so because I think we have a culture that we all survive on that is so we're comfortable in. I think change is difficult now.
Yeah.
Because we are used to things that have made things easy for us.
True.
Yeah.
Definitely.
So, still on pregnancy, out of the stages involved, because I know there are a few stages involved in the whole thing. The most common thing that I hear most ladies complain about is postpartum depression.
Okay.
And what brings about this, and how can mothers manage it?
So postpartum depression, it's a condition that usually happens obviously after delivery of the baby, and it's, so during pregnancy there are heightened hormones. I know I keep on talking about hormones, but when you're talking about women, the term hormones is bound to come up. So there are increased hormones in pregnancy, and then after delivery, what happens is that those hormones tend to crash. So apart from maintaining the baby in the mother, as well as making sure she's healthy, these hormones have other side quests, so to speak. So when the level of them just crashes drastically, it also leads to certain mood swings and things that can lead to postpartum depression. So it's not only hormonal. I mean, just circumstances. A woman has gone from being pregnant to now having a baby, maybe a baby that's not sleeping and she's not being able to eat well, and there are lots of stresses involved when it comes to postpartum depression. But some of the ways that moms can be supported, or rather new moms can be supported, is just having a very understanding spouse, having family to support and, make sure that, okay, she's okay. I mean, depending with postpartum depression, it's a spectrum. It goes from mild, and then it can lead to even psychosis in some people. So, but in cases where it's in the mild form, where most women do eventually, do have the mild form of postpartum depression, it's something that is, it goes away on its own, but it just takes a little bit of time. It takes a little bit of understanding, love and care. It's not just the baby that everybody should be going and checking up on. How's the baby? How's the mom is also nice. You have people that will come and, just be gisting with the new mother, but maybe she just wants to sleep, So some of the things that just as a society, we can also just put in place to try and, support new moms and make sure that they're comfortable. So as the stage of postpartum depression, and then it would eventually go away and resolve itself.
Okay. So before we take our next break, I want to ask you one thing. Does age play a role in this as well, especially in situations where teen mothers are involved? Does age play a role here? It
definitely does. So even by research, it's more prevalent in younger women and especially teen moms, because if you look at it from that perspective, where teen moms most of the time don't have the support that older, or let me say women in their 20s and 30s do have. That stability is not really there. So as a teen mom, she hasn't even finished developing and finding herself as a person, and then she's bringing this whole new human being into the world. So it can be very overwhelming, and teen moms it does play a big role, but then still the support remains. If she can get that support from family, from friends, from her spouse, if there's a spouse involved, then it goes a long way just to try and combat this postpartum depression.
All right, thank you so much. So now we'll go on our next break. I think we need to eat some more. You'll see us very soon. Bye. Very nice big. We're living this age. Living was very amazing. So let's get back into our episode now. I accompanied a friend of mine to the hospital a while back. That was when I told you about the whole me learning about hormonal imbalance stuff.
Okay.
So I was shocked to find out that the gynecologist she met was male, And to me, I was confused because like, I understand okay, this is a female problem. Why shouldn't she meet a female particularly? And overall, I know Islamically it might be a bit off even to have like a male also like participate in these care basically for a female. So I want to know for you particularly, is it morally okay in terms of, because you know in medicine I just want health, you don't even care how the health comes about, but I feel like there should also be morals around how the health is also attained. So I want to hear your perspective in that, because me, I kept asking questions today. I don't understand why is there a guy gynecologist.
Okay. So I think it comes from, I mean, in the society from way back when, you know, it's only just recently that you're seeing a lot of women go into medicine and really become doctors and practice as doctors. So right now, even where I work personally, from like a higher cadre, you're having most of the consultants are males, you know, because but even though like us as junior doctors were coming up, most of us are females, alhamdulillah. So it's going to take a little while for that for that generation to eventually move on and give way for more of the female gynecologists, but we're on our way, inshallah. So that being said, I think morally, definitely, it's better for a woman to see Islamic lima. It's better for a woman to be the one to see a gynecologist. It's better for a woman to see a female gynecologist, and you know, just from an empathetic way, you know, she will be able to relate to her a lot better. Women are a lot comfortable talking to women, the example I made earlier about most of our senior colleagues being men. The females that are there right now get the bulk of the patients, especially that were in the north. You would see a lot of women, northern household women, they'd be like, oh, I want this gynecologist, female, please recommend this female gynecologist. And, you know, a lot of the patients go there because that is who they want to see. I mean, not to take away from the male gynecologists, they're actually awesome. Like, they know their work and they know it very, very well. They're very well trained and very skilled. But there's something that a woman just has over the men. And I think with time, you know, and alhamdulillah, at least, society is changing in the sense that women are pursuing a tertiary education a lot more and they're becoming doctors. And just from the perspective that, okay, female doctors, it's a way of, you know, earning good deeds, right? Like you're being a service to humanity. So, you know, I'm glad that people are shying away from preventing their female children from pursuing a tertiary education and especially going into medicine, because there's this notion that as a female doctor, your life, you know, some parents don't want their female children to be doctors because they're like, okay, when are you going to get married? Or, you know, you can't have that life as a female doctor, which is not true. I mean, I'm married, I have 2 children. So, I mean, it's stressful, but it's definitely doable. And it's just the joy of being a doctor and knowing that you're at least, you know, being of service to humanity. It's really great.
Alhamdulillah. We are lucky to find out about this key information. And having been able to niche down into the specificity that you practice now, I know the medical thing is a broad space. So how did you come about picking this particular direction to follow?
So my journey to being an ONG doctor was not straightforward. From medical school, I didn't want to go into ONG for some very odd reason. I think it also was from a place of rebellion because my mom she wanted to be a doctor, but she didn't get the chance to, and she always wanted to be in ONG. So, and she felt like, and just from what we discussed earlier about most of the specialists being male, it's like, I want you to become a female gynecologist and I want you to be like one of the best ones. And I would always be like, no, I want to be a surgeon. So even after I finished school, it was never part of my plan. But you know, when something is your calling and, you know, Allah just wills that is what it's going to be, like, I just felt being drawn more and more, and circumstances just played itself out. And alhamdulillah, like, I definitely do not regret it one bit. I mean, even now my mom still reminds me. You know the Hausa saying that abunda karami, abunda babba ya hango karami ko ya bishiya ba zai gani ba or something along those lines. So she's always like, I should just listen to her because she knows what she's talking about. And she always pushed me, and it was something that I really found to be. There's a lot of demand for female gynecologists right now, and I'm really glad that, of course, myself and my colleagues are really trying to pave the way and be a good role model to females to actually try and, because we want to kick the guys out of that profession ultimately. No shade to the guys.
So we have
Inshallah.
we shall communicate this. So this is our Gen Z segment. This is like the ending of the stuff. So since we're talking about the future and the Gen Z is the future, in the age of tech today, where we have robots that are replacing surgeons in particular procedures, are there scenarios that you feel robots can also replace you guys in the system?
I don't think so. I mean, I don't know. I don't think so right now. There are a lot of, I feel like robots would augment and make life easier for humans so as to maybe eliminate some human error. After all, it's the humans that are making the robots and, programming them to perform certain tasks. So, but I think it would go a long way in helping and minimizing some little, well, not little, but some human errors like that happen here and there. Like with regards to robots, it's actually, we're doing minimally invasive surgeries even in Nigeria right now. Robotic, not so much. That's more of a US type of thing, but inshallah we'll get it here too in Nigeria and start practicing. So, I mean, as we're moving more and more into the Gen Z age and things being very minimally invasive, maybe before you'd have to cut if you're doing any surgery procedure. I mean, things as so common as anesthesia now. Before, they were doing surgeries without any form of anesthesia, and that's how the person would be screaming and shouting. So, I mean, with age and with as the years come by and technology is improving and progressing, definitely, hopefully, inshallah, robotic surgery and robotic intervention will come to stay. But I don't think it's enough to replace that human brain and that human experience. There's no way a robot can replace a human. Maybe in factories, but not in the medical field.
So maybe even during AI consultation on your e-platforms?
Yeah, on our e-platform, we're the ones behind the AI.
Okay.
Yeah.
Okay, perfect then, perfect. So we are about to wrap up now, and I'll ask you two more things, and then inshallah we'll be done. What practices in your field are done well today, and what do you think could be done better?
Okay, in my field right now, we're really trying to, with regards like screening for cancers and stuff, we're really trying to spread the word and, really raise awareness amongst young women to just come out and, get screened and, just seek for better healthcare seeking behaviors and stuff like that. So I feel like that's one way we're really improving, not only in my field but in general, but then specifically in my field. And just we're really trying to improve ourselves when it comes to just having less mortalities when it comes to maternal mortalities and neonatal mortalities. That's like a death of a mother and a child, by putting some one or two things in place, preventative measures and so on. So I feel like the rate at which that happens in Nigeria is reducing, and inshallah we'll still continue to do the best that we can to try and put these measures in place to help out and reduce that rate, inshallah.
Amazing. So I reached the last one now. Can we do a quick recap in like 2 seconds, if we can do, or maybe 5 seconds, a quick recap on why girl health education is very important, and then we can wrap it up.
It's going to be more than 5 seconds. I apologize in advance, but girl-child health education is very, very important. I can't even overstate just how important it is. I mean, as a young female that's growing up in a society, especially now that
information at your fingertips. So, both good and bad information are rampant and all around. So, like, it's very important that we arm our young girls with the correct information and the right amount of information that their brains can take at that particular stage of their life. As they're growing older, we're giving them a little bit more information, so as when they grow up they become very well-rounded young ladies that can also impart this information to younger girls. We need to try and remove the stigma around female health and female hygiene, so as to just make it a normal thing. I mean, maybe we might not just speak about it so freely, but at least, on a one-on-one basis or on a more secluded basis, we'll be able to pass on the information. It's very key that we do that and we do that properly. And, just try as much as possible. If maybe today you can just, if you have a young sister or a daughter, just, look at her and just have like a conversation about her. Like, is she okay? Like, you don't have to go into details, just not only about hygiene but mental health as well, so that our girls know that they're not alone and there's always someone that they can talk to about anything.
Thank you so much. That was so amazing. This episode is for the big brothers, the little brothers, the fathers, the uncles, the husbands, and the grandfathers.
Yes.
Have a nice day.
Thank you.